Hi, this is Alicia Bright. We're going to apply the concept of inflammation to the disease process of rheumatoid arthritis, which is an exemplar for our nursing concept of inflammation. So I want to contrast this first with osteoarthritis. Osteoarthritis is typically caused by some kind of trauma. I know you studied this in your geriatrics class, and it pertains to older people because, joints wear out after a certain number of years. People start having trouble with them. This can happen as a result of injury or just as a result of wear and tear over time. So it's typically unilateral, but it could be, for instance, in the case of somebody who's got two arthritic knees. Those two arthritic knees are dealing with the same stressors, namely being under the torso when somebody's standing up and walking. So they both individually experience the same stress and develop the same problem. Rheumatoid arthritis, on the other hand, is an autoimmune disease. It affects the whole body. And it usually affects joints bilaterally. For instance, if somebody is starting to feel it in their right hand, they're also probably starting to feel it in their left hand. So rheumatoid arthritis is caused when an antigen triggers the formation of an abnormal IgG. Remember, an antigen is something that stimulates the immune system. These autoantibodies against the abnormal IgG are called rheumatoid factor, and we can test for them in the blood. So early on, we start seeing a rheumatoid synovitis, or inflammation of the lining of the joint. There are also, you'll see increase in lymphocytes and plasma cells, and then over time, articular damage happens, cartilage is damaged in the joints. So figure A shows the inflammation that's beginning at the beginning of the disease process, the area inside the synovial membrane, or the lining around the joint, the area inside of it is getting inflamed. And there can be some tissue swelling around it. Figure B shows a more advanced illness where the inflammation is starting to spread into the cartilage around the joint, and the joint itself is starting to become weakened. Figure C shows more advanced disease. You can kind of see the top part, the bone on the top shifts off to the left. You're starting to see a deformation of the bone. The inflammation extends from the synovial area in through the cartilage and then starts actually eating away at the bone. And figure D is an example of swan neck deformity, or the typical deformity that happens with rheumatoid arthritis. You can see the swelling in the joints, and you can see the fingers sort of pointing off to the side. It's called swan neck deformity, and it's typical of arthritis. That's rheumatoid arthritis. There are different stages of rheumatoid arthritis, and you can kind of see, this is a picture of the healthy bones of a hand compared with a hand that has rheumatoid arthritis. So as I said, rheumatoid arthritis is not just a disease of the joints, it affects the whole body. You can get something called Sjogren's syndrome, which is very dry eyes that can cause damage to the eyes. Other problems with the eyes, lymphadenopathy. They can get inflammation around the heart or in the lungs, pericarditis, myocarditis, or inflammation of the lining around the heart, inflammation of the muscle of the heart, also inflammation around the lungs. You can get splenomegaly or Felty syndrome, an enlarged spleen. They can have a Raynaud's phenomenon, circulation changes in the hands, rheumatoid vasculitis, edema, and peripheral neuropathy. So you can see this is really quite an extensive list of problems that can be caused by rheumatoid arthritis. So we're going to do good assessments on folks, not just the pain level, description of the pain, and their knowledge of rheumatoid arthritis, but signs of joint inflammation, description of what the patient is experiencing with the stiffness, what the patient is experiencing with interference with their ability to take care of themselves, their ADLs, activities of daily living, Maybe get occupational therapy to explore the need for assistive devices. Lab work that can be involved in this include a complete blood count, erythrocyte sedimentation rate, rheumatoid factor, as we mentioned before, anti-citrulline protein antibody, anti-nuclear antibody, and C-reactive protein. These are all markers of inflammation, various kinds of markers of inflammation. So interdisciplinary care, as we mentioned, it can be very helpful to get occupational therapy involved. Definitely they'll need physical therapy involvement, possibly nutritional therapy, and of course medications. So the goal is to relieve pain, decrease inflammation, slow or stop the joint damage, and improve well-being and optimal functioning. So rest is important as well as physical therapy, and I'm going to talk about exercise a little bit more. There are medications that we use, and of course, education. Again, nutrition, therapeutic exercises, psychological support, use of assistive devices. There are alternative therapies, including herbs and acupuncture. Water therapy, we'll talk about in a minute, is very effective. The drugs that we use for this, there are some specific disease-modifying anti-rheumatic drugs, DMARDs. Don't worry about the details of those. They are specific for rheumatoid arthritis. We also use systemic corticosteroids, which you should all know and love at this point after studying Cushing's, and NSAIDs, which should also be very familiar to you. Sometimes we do reconstructive surgery for these folks, but it's not very common. So we do drug therapy, balanced rest and activity, joint protection, heat and cold application, exercise, and teaching. I'm going to talk a little bit about exercise, but first I want to say that for people with autoimmune issues particularly, rest is very important. So people should not overtax themselves. They should provide we try and get them as good a night's sleep as possible, but then rest periods during the day. These folks need to move. They can't stop exercising. If they stop exercising, those joints are just going to stiffen up and get more permanent damage. So we have to keep them moving, but gently, and provide for rest periods. So if somebody's in a lot of pain, maybe they don't do as much today as they did yesterday. Maybe they take it easy today and then try and push a little harder tomorrow. But the kind of exercises that are recommended for rheumatoid arthritis are gentle ones: stretching, walking. Tai Chi is wonderful. Yoga. Not the high intensity yoga, but the gentle stretching and strengthening yogas like Pilates. Water exercises are really good for rheumatoid arthritis, and you'll find special physical therapy sessions that are devoted to this, and pools that are perfect for it. They're usually warmer water, and it provides gentle resistance exercise for people, and it also relieves the weight of gravity on joints. So it makes it easier for people to exercise in the water. It's very, very effective. People can do cycling, strength training. There are specific hand exercises. You saw that swan neck deformity. Hands can get very deformed. We want to keep them as strong and as capable and functional as long as possible. And then gardening. I loved it when I found this on the list. Gardening is not just good for your body because you're out there getting up and down and, pulling things around and, doing a little digging and so forth. It's also good for you psychologically. It's great to be out there working with plants. Most people really experience a beneficial psychological effect when they're working with green growing things. And just a bit about heat and cold therapy. Heat and cold therapy are helpful. We've talked about cold in the past. Heat loosens up muscles. Heat gets things moving. Heat loosens up stiff joints. Hot shower in the morning or a warm bath. Even, applying a warm hot water bottle or heating pad to a joint that's particularly stiff. That's how you get moving. After you've moved, after exercise, it's a good idea because these joints get particularly inflamed during exercise. Afterwards, you want to cool those joints down. So ice bags are really helpful, or ointments that cool things down, but particularly uh, ice bags or cold packs can be very helpful. This doesn't just reduce inflammation and pain, it can also reduce injury to the joint over time, because remember, the injury is caused by inflammation. Okay, and that's it for rheumatoid arthritis for today.